So I'm wondering how many cases do you believe there are in Alberta? Previously, during the height of Omicron wave, you said we were about catching 1 in 10 with testing so limited. What do you estimate the virus numbers truly are here in the province?
It's difficult to give you a specific number. We have worked through the serology results that we got from the samples taken in late December and early January. And so comparing those serology samples with the case numbers prior to sort of mid to late December, which is the what would have been captured by the timing of when that serology was taken, that did validate that estimate of approximately 1 in 10 at that point in time. It's likely that that ratio has changed, given that it was after that late December timeframe that we changed our eligibility for PCR testing. So it will quite certainly be a greater gap than just 1 in 10, but what that estimate is very difficult to say. We anticipate that we will have our updated serology data in about a month to be able to understand what that actual number of cases is. But again, it would be greater than that ratio of 1 in 10.
It's a hopeful time as we continue to return to a more normal life. But we need to acknowledge that COVID-19 remains with us, and the health system is still under significant pressure. More workers are returning to in-person to their workplaces. Families are revisiting spring break traditions, and Albertans are getting back to the routines they had pre-pandemic. There is no question that COVID is still with us, but as time passes, we continue to see the impact is less than it has been in the past, and our health system continues to recover from the 5th wave of COVID. Looking at hospitalization numbers today, there are 956 people in hospital with COVID-19, including 56 in ICU. Like most of our numbers, hospitalizations can fluctuate from day to day, but I'm pleased to report that hospitalizations due to COVID continue to drop, slowly but surely. I'm also pleased to report that COVID-19 outbreaks in hospitals have fallen significantly since the peak in mid-February. At the peak, 38 acute care facilities had active outbreaks. And as of Monday, March 21st, only 11 facilities reported active outbreaks with minimal impact on patients. I know this is a relief to patients, families, and staff. And the system is nearly back to normal surgery volumes, approximately 96% of average weekly volumes in pre-pandemic years. Our surgical wait list is stable at around 76,350 this week, compared to approximately 78,400 at the beginning of last month. Now, for context, the wait list was 68,000 in February of 2020 before the pandemic, and at its peak, after the 4th wave, it was 81,600. Now, the current list is too long. We need to get it down, and we're working on doing that. But the reality is, this health system has gone through an unprecedented global crisis, the equivalent of 5 winters in the past 2 years. And the impact on patients has been much less than it might have been thanks to our dedication of our health workers.
Turning to the numbers, the leading metric that is most useful at this time is our positivity rate. And between Friday and Monday, this ranged from 20.6% to 27.1%, with an average of 23.5%. As the minister mentioned, there are currently 956 people with COVID-19 in hospital, including 56 in the ICU. Sadly, since Friday, an average of 5 deaths per day related to COVID-19 have been reported to Alberta Health. These individuals were between the ages of 54 and 94. This is a reminder of the fact that this infection is still a significant threat to many of us, our families, and our friends. It's important to take this seriously as we move into activities we haven't done for a while and consider how best to support those around us to mitigate the risks. My thoughts are with anyone who has recently lost a loved one, whether to COVID or any other cause. We have had many questions from Albertans about the BA.2 subvariant of Omicron that has been in the news recently, and I'd like to share what we know so far. First, it's important to remember that many viruses constantly change through mutations. This is to be expected, especially with a virus as transmissible and prevalent as the one that causes COVID-19. This is why, since the start of the pandemic, we have been actively monitoring the genetic code of the SARS-CoV-2 virus in the province. This has helped us to understand how the virus is evolving in our population and to detect the arrival of variant strains from outside the province. As we've seen over the last 2 years, some variants emerge and disappear without large impacts, while others persist and become dominant, like Delta and Omicron. Currently, all COVID-19 cases identified through PCR tests are screened for variants of concern, and our variant screening and sequencing for genomic surveillance picks up variants and subvariants, including BA.2. As of March 21st, approximately 60% of positive cases are BA.2, so it is now the dominant strain of Omicron in the province. Although inherently more transmissible than BA.1, so far there is no evidence of it causing more severe disease than BA.1 based on clinical data from South Africa, the United Kingdom, Denmark, and Ontario. While this is good news, we only have to look back to the 5th wave to see that a virus that is more transmissible can cause a large impact at a population level, even if the risk of severe outcomes are the same or lower for individuals. Therefore, we should expect to see transmission trending upwards in the coming weeks, meaning that those at risk of severe outcomes should revisit their precautionary measures, and those who have not yet gotten their booster dose should do so as soon as possible. This is particularly important for those who are 65 or older, or those who have medical conditions like COPD or diabetes that put them at higher risk for severe outcomes. A booster now will provide important added protection in the coming months.